I'm Sarwat Masood, an internal medicine resident at the Department of Internal Medicine, North Knoxville Medical Center in Powell, Tennessee. I'm presenting a case of colonoscopy in a patient of neurogenic bowel. It's a case of a strong gastrocolic reflex. I had a 46-year-old male who had a spinal cord injury above thoracic spine 12. He was scheduled for a screening colonoscopy. This patient was advised Miralax bowel prep. He continued to eat all day prior to his colonoscopy. He drank the Miralax bowel prep in the evening and was able to achieve a full bowel evacuation and a clean colonoscopy. Colonoscopy is an important screening procedure. Colorectal cancer is the third most common cancer in the United States. Bowel prep is essential to prepare a clean bowel prior to colonoscopy. We hypothesize that in this specific case, the patient had a spinal cord injury. He was able to achieve a clean colonoscopy due to a strong gastrocolic reflex. This case is unique in the context of a spinal cord injury patient undergoing colonoscopy. When we studied the literature, it mainly focuses on neurogenic bowel and its symptoms in patients of spinal cord injury. There is very little literature on colonoscopies in neurogenic bowel and spinal cord injury patients, which is why we are presenting this case. Defecation and evacuation of bowel can be achieved through several mechanisms, one of which is a strong gastrocolic reflex. We hypothesize that this patient had trained his bowel in a way that he was able to evacuate his bowel completely with a strong gastrocolic reflex while using only the Miralax bowel prep. We have described his colonoscopy findings. He had 2 sessile non-bleeding polyps, and he was able to achieve a high quality, clean colonoscopy. We present this unique case of a patient with neurogenic bowel. This case is of significance because literature is lacking on colonoscopies in neurogenic bowel patients, the type of bowel prep they need, and bowel training in neurogenic bowel patients. When we searched the literature, we found that Haim et al. Studied 311 spinal cord injury patients in a VA center, and they recommended that colonoscopy was safe in a special population of patients like spinal cord injury patients, and it should be encouraged in this population. However, colonoscopies come with challenges in this patient population due to neurogenic bowel, due to issues of transportation for appointments, and bowel prep issues. A colonoscopy is an important screening procedure for determining and detecting colorectal cancer, and the effectiveness of colonoscopy is dependent on the bowel prep. Unfortunately, 1 in 4 colonoscopy is incomplete due to an insufficient bowel prep, and improving access to a well-tolerated bowel prep can continue to decrease barriers for screening colonoscopy. This is a unique case because literature is lacking on the type of bowel prep and bowel training in neurogenic bowel patients. We're excited to present this case. We look forward to seeing you soon. Thank you.